Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi-Spa, and welcome tonight for another episode of our Facebook Live. I do want to say to everybody who tuned in last month, we had a very special program, so thank you for joining in. We had 5 really brave ladies who discussed their kind of walk through their treatments with breast cancer in all different stages. So if that is something that you want to see, please go back and revisit it. Tonight we're going to do something a little different. We're changing gears. We are now moving into the holiday season, which is a lot of festivities, Christmas parties, office parties, family getting together. So this is the time where most of us are thinking about putting our best foot, or in tonight's case, our best face forward. And so tonight's topic is Botox. We're going to talk about what it is, how it works, what's different about Botox versus other products that are on the market, because there's some confusion that people have between Botox and dermal fillers. We have a special guest tonight. This is Pamela. She's our nurse injector here at Bellissimo. Pam's been with us for about 1.5 years, and I can tell you, bar none, she is probably the best injector I have ever worked with. And so I'm very pleased that she's part of our staff. Pam really has the combination of a technique which she'll demonstrate tonight, and she's going to demonstrate it on me of how to inject Botox. So she has a very easygoing technique. I've had it with other injectors who are also very good, but nothing like this. This is, basically painless, as you'll see. But she also has a very keen eye for the aesthetics. And from Botox, she's famous really around here for her lip volumization and also the cheeks. So in coming months, we're going to have her demonstrate the use of Voluma for cheeks and Juvederm to the lips. But tonight we're going to concentrate on Botox. I am going to be the patient tonight to show you that, yes, even men get Botox. And as we've looked over the past years of statistics with Allergan, who makes Botox, there's always a steady increase in the amount of people using Botox every year. But what they found is one of the fastest growing populations for use of Botox is men. And as we go through tonight, you'll see why. It gives a very nice result. There's basically very little downtime. I think the last time that Pam injected me was several months ago, and it was in between patients. So, I can take time out, get Botox, and go right back to seeing patients. So you'll see that tonight. But we want you to interact as always, ask questions if this is something that interests you. Please be a part of the conversation tonight. I have tried to lighten Pam's load during the day so that she's rested and had a nice day today, so that everything goes smoothly for me tonight. So with that, I think we'll just turn it over to Ella, and she can start.
What exactly is Botox?
Botox is a prescription medication that's been manufactured. It's used by injection, and it basically temporarily blocks muscle action. And we'll go through that, but it's a temporary blockage. We all know it because, again, we're talking about from an aesthetic standpoint and all the marketing. Most of the time we talk about lines across the forehead, between the eyebrows, along the crow's feet. So that's the most common treatment that people know. But Botox has really been around a long time. It is really used widely as well for muscle spasticity. So eyelids that are spasming, people that have hemifacial spasms of the facial muscles, that can be injected there. It can be injected into the esophagus for some patients that are having difficulty swallowing. We found that it works well for people that have excessive sweating of their hands and armpits, and also masseter muscle, that people are having problems with TMJ issues. That really helps. And also now is becoming widely used for the treatment of migraine headaches.
Is Botox considered safe then?
It is safe, and I think that's one of the biggest myths about Botox, is that over time it's going to wear out or paralyze a muscle or damage a muscle so that the use is not ongoingly is diminished. The way that Botox works is actually very unique. The molecule of Botox, when you look at it under a microscope, has a very similar shape to something called acetylcholine. Acetylcholine is made by all of our bodies. It's a neurotransmitter. So think of acetylcholine as a group of molecules sitting at the end of a nerve. And when the brain wants to basically flex a muscle or activate a muscle, it can send an impulse down the nerve. And in this case, when my brain tells me to raise my eyebrows, it's firing a nerve along the nerve to contract my frontalis muscle. What ends up happening is that when the impulse gets to the bottom of the nerve, depending upon how much my brain wants my eyebrows to be raised, a different amount of acetylcholine can be released. The acetylcholine is the chemical messenger that comes from the nerve across a very small junction and now binds onto small receptors of that muscle. The muscle then reacts and contracts. Botox looks very similar to acetylcholine. So when Pam injects that into my frontalis muscle, those molecules will bind temporarily to those receptors of the muscle. Now when my brain, when they're fully activated, when my brain says raise my eyebrows, many of those receptors are already full. So when the acetylcholine is released, there's very few receptors that it can bind to. So I will be able to wiggle my eyebrows a little bit, but not to this extent. So it's kind of a competitive inhibition is what it's called, and it's very unique. So the acetylcholine then just falls away, it gets broken down, and there's no damage. Over time, the Botox will start to break away too, and it happens over time that they'll just start to fall away from the receptors. So the muscle is not damaged at all, and you'll know that it's starting to happen because over the next several months, all of a sudden my eyebrows will start to work more and more, and I'll know that the acetylcholine now is finding more receptors as the Botox gets broken down. So no damage to the muscle long term. People have been using it for 15, 20 years along the forehead and still have as much action today as they had when they were younger.
I wanted to let you know we have Lillian Basinger saying, "Hi, Pam." And T.D. Carlberg says Pam is wonderful with her craft. We've had a lot of comments about Pam is wonderful. Don't hesitate to schedule an appointment with her. And Pam is an artist, so people obviously know you in this area. Will Botox make me look like I have had work done? Does it,
well, I think most people think of that as the frozen look. That's been depicted in many movies and stand-up comedians. We don't go for that look. I think I'll let Pam talk about that more. We want a natural look.
Yeah, we kind of we're more conservative. We want to relax the muscles, still have movement because we're all animated, so we want movement there. We just want to eliminate the lines. So it's a very natural look.
Do Botox injections hurt?
Well, he will tell you that shortly.
We're going to see that shortly, but I can tell you it is absolutely almost no pain at all.
All right, so we're going to get started. The area that Dr. Antimarino is concerned about is the forehead area, which consists of the glabella muscle and the frontalis muscle. So we're going to take care of that.
Can you raise your eyebrows so we can see? Oh.
This is what my children call my stripes, so we're going to soften
Now
those.
make your mean face. So this, you can see his glabella muscle right there. So we're going to relax that as well.
Do you need to hold my hand?
So we cleanse the area and we give it a minute to dry before we inject. Okay, now I'm going to have you make that face again. Relax. And we simply do a few injections right here in the glabellus muscle. Painful?
No.
Okay.
Lillian commented, "Best doctor ever."
Thank you to Lillian.
Are you having any pain?
No, honestly, it is absolutely not painful at all. You can barely feel it.
Now, I see little spots. Do those fade?
Yes, by the time we're done with the procedure, I'm going to ask him to do a few exercises, and that's working that into the muscle, and those will be gone in just a few minutes. So it'll work its way into that muscle. By the time a customer leaves the office, you can't tell you've had anything done. Okay.
Like I said, the last time I actually went back and started seeing patients again in the office, so
Now we're going to get rid of, what do your kids call that?
The stripes?
The stripes. Okay. And this just consists of a few injections in his frontalis muscle. Raise up again.
So I guess this answers the question, how long does the treatment take? Because we can see you're moving pretty quickly and it looks like you're almost done.
Yes. Just a few seconds to inject here.
So when a patient comes in to see you, they have a consent, so their time would consist of filling out, they read through the consent.
Yes, we review the consent. We review what areas that they're concerned with and what they would like to be treated. We talk about the action of the drug and the activity after the procedure, because there is some limited activity. We don't want them exercising after they leave the office. We don't want them laying down for 4 hours after they leave here. No bending over a lot or lifting more than 50 pounds. The next day they can resume all activity. And like I said, I would ask them to do a few exercises, and that's just making, yeah, he's doing them now, getting that worked in there. And as you can see, the first ones are almost completely gone.
How much is injected? Does it vary?
It varies per person, depending on the size of the forehead, how strong the muscles are. All those go into factor that. So you will know in your consultation, we go over that, how many units you would need, and we would discuss that prior, so that way you know everybody's different.
Do you usually use more for men than women?
Yes.
After a treatment, how long until that has full effect?
The treatment starts working now. You will not see tightness, or you won't feel the effects for 5 to 7 days. It can take up to 2 weeks to fully settle in.
So if a patient feels like they didn't get the desired result, they would come back and see you after 2 weeks?
After 2 weeks, yeah.
So what we try to do, especially if you're a first-time patient here, again, we try to be very conservative. We don't want that frozen look, so we'd be conservative with the amount of Botox that we use for the initial treatment. And then as you come back 2 weeks later, then we can assess how much movement you have. We can add a little bit at that time, and then that way we can streamline your next visit or your next treatment, knowing how much it takes for you. But it's always better to be able to go back and add more than to give you a frozen look that you may not like.
What locations on the face can you get Botox injections?
Botox is mainly from here up, so that we can, the forehead, periocular around the eyes. You can do the nasal muscles, but basically here up.
So the lines by the eye, is that what people call the crow's feet?
Yeah, so you have crow's feet here. Many women we call the smile lines. When ladies smile, they really hate those little wrinkles that come in here. So in here, some people develop a horizontal line right above the nose here from the procerus muscle. So you can actually inject right here, and then the little bunny lines that we call the bunny lines here from wrinkling our noses. So that can be treated as well.
Now, if you only get in a specific area like between the brows, does that mean you would get lines developing elsewhere? Would you see that over time, that if you've used Botox in one part, the other muscles become...
I've heard that. Everybody has a certain way that they animate their face. Some people do it when they're talking and they're very expressive. Other people do it as you raise your eyebrows to let in more light so they see better. But depending upon what your animation features are, we can treat those areas. There are some people that say that when you take away that muscle that you normally animate with it, you might use others. And if that's the case, then we can treat those muscles as well. But I haven't seen that. It's just something that I've heard or read about.
How long do the Botox results last?
3.5 to 4 months. Everybody's different, but the average is 3.5 to 4 months.
And what are the differences between different injectables?
Well, I think this is where the misinformation, there's many times that we'll have people coming in saying, I have these lines between my eyebrows, I'm not sure if I need a dermal filler or Botox. So Botox is used to treat those lines that are associated with muscle animation. So the horizontal lines from the frontalis muscle, so horizontal lines across the forehead. Also those vertical lines between the eyebrows, as Pam was saying, the corrugator muscle that pulls in. Any muscle that you can scrunch and get a line from, that's what Botox will treat. There's other lines that you develop due to aging that are around the mouth, down here for the marionette lines. What are the ones that you treat mostly?
Mostly the marionette lines, but a lot of women come in asking about how do I correct the lines around my mouth. And that usually then pertains to a volume filler. You want to fill up a space. So then we would go into a consult of how does dermal fillers work. And we do have multiple dermal fillers here that work in different areas to take care of that.
Right, so the lines that as we get older and the tissue on her face comes down and forward, then these lines around the mouth called the nasolabial folds and the marionette lines, because people start to get jowling, and so that's from things starting to slide forward, and that's where you need more of a volumizer, and Botox won't do anything for that.
And I've heard talk of Kybella. What does Kybella do?
You're the expert on that one.
Kybella is a product that basically right underneath the chin area is a little fat pad. Kybella is injected into the fat pad, ligases the fat, basically eats it away. Everybody's different as to how much product they need and how many sessions they need. But it just is this small area right underneath the chin.
There's some Botox myths out there. Can you dispel some of those for me? I believe you've already answered the damages or weakens the muscle, which you talked about previously.
Right.
And you just talked about correcting all lines.
Right, and again, we're trying to soften the activity so that you still have animation to your face, and so when you're talking to people, you don't look different. You still can animate so that you can have a conversation. When you have that frozen look that was really back in the 90s and 2000, early 2000s, it was kind of hard to talk to somebody that wasn't animating when they spoke. They had that mask look, and that's not something that we go after or a look that we want to present. So we want to really soften those lines. Many lines that are actually very deep over time will actually get softer and softer, and some will actually just disappear.
Is it true if you have plastic surgery you will never need Botox or fillers?
No, I think that's a big myth that when people come in to talk to me about facial rejuvenation as a facelift or eyelid surgery, and the big concern then is that deepening of the folds, the jowling that's coming here, the neck laxity, and everybody wants that nice kind of smooth look, and they feel like if I did a facelift, it's going to correct all of these lines, it's going to correct the lines around the mouth that Pam was talking about, and it really doesn't. Surgery will soften those lines, but it won't take away the need for Botox or dermal fillers in the future. It doesn't mean you have to have them, but if you want, you will get some correction here. You will get softening as that tissue is basically reestablished back to its more natural resting position. You will see dramatic improvement, but you're still going to have some lines, and that's a more natural look than no lines at all. But sometimes you need a little bit, or some people would want just a little bit of dermal filler or some Botox to help soften it even more.
Sherry asks, what is the magic trick to getting your husband into the office to have this procedure done?
I think most men, I can tell you, this is probably maybe the third time I've done it in the past year. I've been in practice 16 and a half years. I've done it for people. I've injected Botox. I've referred my patients to our own spa hundreds and hundreds of times, and I hadn't done it. It wasn't that I feared anything. It was just I just didn't think about it much, and it wasn't really on my thought process. And so finally, when I decided, I've always sort of wanted to do it just to try it out. And once I tried it once, and I realized there really isn't any pain. You can, we can go back and look at the video, but I don't think, I didn't even feel it. I can't work out tonight, or I can't do a couple of things tonight, but tomorrow I'll be back at full strength. I think when men realize there's no pain involved, very little downtime, and how much it actually works, I like it. I like the look of it. I like the feel of it. You kind of have a little bit of a heavy feeling, and then you kind of get used to that when you try to fire those muscles. It feels like it drags a little bit, but when it wears off, I actually miss that look and the feel of when I had it. So I think guys, just because guys just don't think about it that much, but now as more and more guys are doing it, I think guys will be using it everywhere as much as women because it's so easy.
I think the stigma that it softens and it's a more feminine verbiage that's used instead of it's a more youthful appearance.
Right.
The dialogue needs to change.
It does.
So that a man doesn't feel.
It takes the harshness away. Like those stripes that I have, that's kind of a harsh look. It softens it. That it's just that they're not as deep. They're not as acute. So it softens them. But I think again, how you treat a man with facial rejuvenation is different than a woman. The same way if I'm doing eyelid surgery and facelifts for a man, my end goal is different than a woman. A woman, you want to be a little bit more soft. You want to have a little bit smoother outcome. With a man, that looks weird, for lack of a better word. Men are supposed to be masculine. We're allowed to have lines, that Cro-Magnon look. We're allowed to have crow's feet. So when you do that, we're very conservative with the amount that we use. I'm conservative with the facelift because you don't want to take away that look. You want to soften that look just to take some years off, but you certainly don't want to make a man smooth. So I think that's the big thrust. I don't know if you have anything else. That.
And we're seeing more and more men getting Botox treatment.
I've heard the term Botox. Is that a new hip term to be used?
I think it's just a marketing ploy.
How can I save on Botox treatments?
There is a program that the company that makes Botox, and that is Allergan, they provide for all customers. It's easily to sign you up for it here, and it's a rewards program. Each time you get a treatment, you obtain points that turn into a coupon off your next visit. So we make it very easy for you. We help you sign up. We help you create those coupons. So each and every time you can get a discount.
Mm-hmm. Okay.
That's all the questions I have for you.
Okay. Well, listen, thank you again for tuning in. I hope this was informative. I hope that it helps some ladies out there if you feel like your gentleman needs to have a little bit of softening, that you can show them the video. You can realize that it's not that painful at all. It's well tolerated. So if you need any more information or would like more information, then I would encourage you to go to our website, www.bellissimoplasticsurgery.com. You can sign up for our newsletter that comes out every month. It lists all of our specials for the upcoming month. We have interesting articles, any other information that we can share with you. You can follow us on Twitter, Instagram, and Facebook. Facebook also has all of our specials on it, so I encourage you to go there.
We also have a new Contact Us.
That's true. Our website has been updated, so we have an easier way for you to contact us, other than the phone number 844-496-6647. But on the website, there is a tab called Contact Us. You can click on that. It actually will have another tab at that point that you can contact us through our website, through a protected portal. It's HIPAA compliant, that you can ask questions, actually have a virtual consultation with either myself or Pam, that we can look at photos, answer questions for you, and is very personal, very direct.
Okay, before we go, Pam, you look great. Last comment.
Thank you.